Hi, everybody. My name is Zen Tuan, and I'm a licensed acupuncturist at Healing with Zen. We are located in Pasadena, California, and our phone number is 626-377-9596. You can find more of our testimonials, our ongoing case studies, and other videos like this on our website, which is www.healingwithzen.com. So I'm really excited today. One of my long-term fertility patients came in and confirmed she is pregnant for her second time, and she's going to be having twins. To clarify, this is her second pregnancy while working with me getting acupuncture. So I thought I'd talk a little bit about fertility today. Fertility cases can be complex or simple. A lot of times when they come seek acupuncture, they've already been trying for some time without success. So I always tell my fertility patients, you have to expect minimum 3 to 6 months working with me because it takes me about 3 months to track your cycle and see how you're doing before we can even get more work done. Now, I say realistically, we're looking at about a year to a year and a half to get pregnant. And I set that expectation there first. A lot of times we are able to get our patients pregnant quicker, um, and it just depends on the complexity of the situation. Now, this case, like you'll see, there's a lot of factors and a lot of things variables that can affect fertility and why a couple is or is not able to conceive. So let's jump right into it. This is a 36-year-old woman. When she first came to see me, she was 32. It was in August of 2015, and she had already been trying to get pregnant for some time, less than a year. So she got off of her birth control pills 1 year ago when she came to see me, and she had been on birth control ever since she was 16 years old. She started to reach out because she was getting irregular menses. Instead of having a period every month, she was starting to have them every 2 or 3 weeks with spotting. Since she got off the birth control, she got some weight gain and she was hormonally imbalanced. She had lots of PMS, which included gas and bloating, breast tenderness, and acne along the chin area. She has low back pain, some neck and shoulder tightness. She also said she had cold hands and feet, tinnitus in her ears, which is ringing, frequent urination, and she was always battling with depression and anxiety and was taking Xanax. She also had some insomnia, waking at night, and hard time going back to sleep. So the list of symptoms that she had was pretty long, and I told her, let's get started and do a course of treatment. So she was very good. She came in once a week for the first month, and then I think she was traveling for a while, and then she had to take a month break and came back to finish off the first 10 treatments. By the time we did the reevaluation in November of 2015, we had regulated her period. It was coming regularly every month. So that was 3 or 4 months of regular periods now. And a lot of her symptoms were diminishing. She had less low back pain. Energy went from a 3 out of 10 to an 8 out of 10. Um, and PMS was a lot more managed as well. So we continue to do our treatments. We continue to see each other 1 time a week. And of course, sometimes she would have to miss here and there, but we did that continuously for almost 6 months. Okay, at 6 months in February of 2016, she went and her doctor told her that she had a blocked fallopian tube. And she got a procedure done for that, and it cleared up quickly. Fast forward another month. By 7 months, I told her, "Hey, let's reevaluate. How is your husband doing?" And since the beginning, I told her that when I do fertility treatments, I try to see both male and female together if possible, because that's going to help me balance out both situations and create the most optimal environment to get pregnant. She was finally able to convince her husband to come in by early April, and this is after he went to get tested for his sperm. And turns out his sperm count was good. His sperm motility was just satisfactory. And what was the problem was the formation was very low. It was less than 1%. So he started to come see me, and we did a whole course of treatment together with her husband. We talked about diet, cutting out alcohol, and really cleaning up his diet and exercising. He ended up losing about 18.5 pounds. And when he went back to test his sperm in July, everything came back normal. So that's April, May, June. So 3 months. We worked together for 3 months, and he was coming one time a week as well. So after his sperm tested normal, month later they were pregnant. So it was a full year until she got pregnant. Okay, and she continued to see us throughout her pregnancy, 1 to 2 times every month, just to maintain pregnancy symptoms. She had some nausea, she had fatigue, aches and pains here and there. She had a healthy baby boy. It was a C-section on May 5th, 2017. So I was really happy about that case. She ended up coming back 2 months later. She was suffering from postpartum depression, and we've been treating her on and off ever since then, just for various issues. She came in last year and said she wanted to start getting pregnant again. This is 2018, end of 2018. So we started working on pregnancy again, and here we are. Today is June 19th, 2019, and she is pregnant with twins. I want to mention that the patient never went back and took the Xanax since she's been working with me. Instead, I give her Chinese herbs whenever she feels depressed or anxiety is extra high. And so we did that postpartum. All the herbs that we used were safe for breastfeeding, and she breastfed all her first up to 2 years actually. Fertility cases can be complicated. There could be a lot of different issues that are going on. But if you know anybody who might benefit from this video or who is struggling with fertility, please reach out to us. Our number here is 626-377-9596, and you can find more of our videos and testimonials on our website at www.healingwithzen.com. Thanks for watching. Once again, my name is Zen Tuan at Healing with Zen, and I thank you for watching.